My name is Sayoko Moroi. I'm the chair of the Department of Ophthalmology and Visual Sciences and the director of the Havner Eye Institute at The Ohio State University. So when I arrived at The Ohio State University, I felt the excitement, the passion of really growing and developing and being a leader in many aspects of the academic mission. Specifically, in working with Dr. Andy Hendershot, who's our residency program director, and Dr. Mike Wells, who's the director of medical education, I really wanted to push hard to align with the College of Medicine with their outstanding clinical skills, education, and assessment center. So we had the bold ambition and goal to develop this surgery clinical learning center here within our department.
Our journey to this skills center really started in my mind when I used the slit lamp simulator at AUPO and at Academy many years ago. I was so impressed with the technology, and I just couldn't really stop thinking about what power this could have for ophthalmology residents, for ER residents, for medical students, to really broaden the access to ophthalmology and get everyone starting at the same level. I think one of the biggest benefits for simulation and training for me is the repeatability, the fact that every resident can get access to and practice the same exact thing. That doesn't mean every resident uses it the same or gets the same out of it, but all the opportunities are the same. You don't have to wait for a rare patient to come in with a disease that you're only going to see once or twice in your career, or a rare complication or a rare setup in the operating room. That can be simulated for each resident, and then they can practice that as many times as that individual resident needs to master either that skill, that technique, or that maneuver. So we're going to take some of that, planet aligning out of it, just being able to reproduce so many of those kind of rare events at the same time, and then letting a resident practice that again and again and again until they're comfortable and confident in that skill.
One of the biggest things about having a facility like this is just being able to get like a dry run before going to the OR. I think that is so helpful. Of course, the first time you're doing any type of procedure, just starting off, there's a lot of anxiety that's associated with being in a new environment, with being in the OR, but then also having to navigate all the intricacies of like performing this procedure. And so being able to have an environment where you can kind of do things on your own timeline and focus on things that you really want to focus on, and at least be confident in that portion, is really helpful before entering a completely new environment that has even more factors to really hone in on your skills and provide the best learning opportunities possible.
With our strategic plans and what our goals, they align both with the College of Medicine and have generous support from them. But also when I share that vision with community ophthalmologists, also with alumni and grateful patients, they believe. And so they believe in our mission and what we want to do. And the bottom line is to develop outstanding clinicians and surgeons to serve the public and to improve vision outcomes for people. So these kind of ambitious goals are related to education, as we have done here with this facility, also with research to make new discoveries that will lead to innovations and breakthroughs for perhaps new diagnoses and new treatments, and then making sure we provide the clinical care with excellence here.